If you are getting ready to retire, you almost universally expect that Medicare, original Medicare from the government that you've paid into your whole working life, will give you some coverage for dental, vision, and hearing. It doesn't. Almost zero. Stay tuned and I'll explain. Dental is really expensive. You know, you used your teeth every day for 65 years. And some of us didn't have the best oral hygiene. Some of us smoked. And therefore, there's a lot of problems that are very expensive. And if you've never had a problem yet with your teeth, you're in for a big shock. One root canal, one implant, one infection, one crown. We're talking thousands of dollars. So most people are very shocked. And they're saying, okay, it doesn't seem fair. There's legislation pending by Bernie Sanders. You know, they're printing money up there and they're giving money to, you know, student loans and apartment rental. They're giving money. So they're going to give money to some retirees. And they are proposing to add a benefit for dental, vision, and hearing onto Medicare. If they do, the price of Medicare Part B, the price of your Medicare Part B deductible, the prices will all go up to absorb that. So don't complain when you get big rate increases if they do get this passed. If they don't get it passed, you can buy standalone dental and vision coverage, just dental. And for, except for your high rent states, so except for New York, which never gets approved, California, very expensive. Let's say the majority of the country, for a 65-year-old female, it's probably around $45 a month. So if you do want to buy private dental, vision, and hearing coverage right now, everybody can have it. They don't ask you health questions. You can get it, but there is a waiting period. So if you're like, yeah, I need a crown right now, you'll typically have to wait a year before you can get that crown covered. And we, like I said, we represent lots of companies, and it depends on what state you're in, which one might have the best coverage for you for dental, vision, and hearing, or typically what you just want is dental, okay? Because the dental is so expensive. If you just have original Medicare, you just have your Medicare red, white, and blue card, you didn't supplement it with a Medicare Advantage or a Medicare supplement. Original Medicare does cover a little bit of vision. It will cover cataracts. It will cover macular degeneration, which is unfortunately a complication of advanced diabetes. And it will cover glaucoma. Okay? It doesn't give you an annual eye exam, and that's what people want. They want to go to the eye doctor every year. It does not cover that. As far as dental, original Medicare, what you get from the government, what Medicare Part B, covers no dental at all, zip. People don't believe me. They're like, how can that be? Doesn't cover any. Now, let's say you get in an accident and your jaw is damaged. There's like some emergency stabilization that they will do that is covered. But they're not covering dentures, implants, crowns. All this stuff is very expensive. Original Medicare will cover none of it. And then hearing. Original Medicare doesn't cover any hearing at all. It will not give you an exam to see if you need hearing aids. And it, by God, does not cover anything for hearing aids, which, if you're wondering, are expensive. Now, the price has come down tremendously in the last 5 years. You used to have to pay $7 grand to get the top of the line. I know, because I went to buy these for my mother-in-law, which she does not wear because she doesn't like them. But now you can get really good ones, and I'm not paid by Costco, but Costco has some really great ones, much more affordable. And then a lot of these Medicare Advantage companies, they have dental, vision, and hearing benefits already in the plan. Most of them you don't pay extra to have a little vision, a little dental, and that's something that we've really seen kind of creep up over the past couple of years, and that could stop at any time. So with all these inflationary things that are competing against the insurance companies and the new taxes that they're going to be under with the Biden administration, they could very well reduce those benefits. The Medicare Advantage companies could get rid of those little extras, which they'll be the first on the blocks, and that's dental, vision, and hearing. But for right now, we're still looking at a great option. If you need those benefits, you're not going to buy a Medicare supplement unless you buy a separate dental, vision, and hearing plan. Like I said, depending on your age, $35 to $65 a month with a deductible, with a copay, with weights. Or you can go the Medicare Advantage route in which in many cases, especially in the big cities, it's already in the plan. You don't pay extra for it. You go to their network eye doctor. You go to their network dentist. Might not be your dentist. And then there might be small copays. Some of them have no copays. So that's what dental, vision, and hearing looks like in Medicare today. If you have any questions, please put them in the comments below. If you need help, if you need to buy a dental, vision, or hearing plan, we sell them all over the country here at the Medicare family. Call me or contact me in the comments, or you can call us at themedicarefamily.com. You can email me directly, Sylvia, Sylvia, @themedicarefamily.com. Thanks for watching.